WebEx this morning from the hospital. Dr. Greenberg, you can hear us all right? We can hear you, hopefully.
Indeed, Scott. Thanks so much for having me.
You bet. Good morning, and thank you for being with us. And so let's get started by maybe talking a little bit about conditions at San Juan Regional these days. How are things doing?
Well, I have to say, we are in the midst of our fifth wave. The state of New Mexico has had increases in cases for some time. We're watching it very closely. And the total number of cases we've had since the beginning of this pandemic in San Juan County is up to now 17,402. We've been following our COVID cases in the hospital very closely. We're up to 33 COVID cases with 2 PUIs presently in our facility, and also seeing a very high number of cases, both COVID and non-COVID, requiring the ICU. We have 12 COVID patients in the ICU now, and a total of 19 patients that require ICU level of care. Now, keep in mind, we only have 14 ICU beds, and so we're working with the great staff here to make sure that we're providing superior care, and have opened up a second intensive care unit, which we've had open intermittently for the better part of 2 years now. And so we're continuing to follow this very closely. We're back on the patterns of making sure we have enough supplies, including respiratory equipment like ventilators and non-invasive ventilatory devices, because we're using increasing numbers of those items. Also keeping very close track of what's happening with the resources that we have available to take care of these patients, including things like pharmaceuticals, but most importantly, really looking at how we'll have enough people to manage the increased number of these cases. And so it's been a challenge where we've now done this, a few times over, and so everyone knows what to expect. And I hope everyone can feel confident that their local facility is doing everything possible to make sure that we remain prepared and available for care, both COVID and non-COVID, to make sure that we can take care of residents in the Four Corners.
That's good to know, Dr. Greenberg, and thank you for that. I wanted to ask you, too, I know before in some of these surges, we'd heard talk about maybe some elective surgeries being postponed at the hospital and some of those decisions being made, which may be a higher pay grade level than you. But have you heard anything about that, or expanding the COVID unit and things like that in preparation for more patients coming in? Can you give us an update on any of those things?
Absolutely. I mean, we are actually, when we had a larger number of patients, COVID patients during the previous surge, we peaked at 100 COVID inpatients. So we have considerable depth at this time. Now, 100 COVID inpatients is a really, really large number. And so when we're discussing how to manage these patients when it comes to space, the equipment, and the personnel associated with it, all of those elements that you just discussed are on the table and actively discussed. Is it the time to reduce elective surgeries? Should we try to relocate or reassign certain personnel? All of these things are discussed on an ongoing basis to make sure that we can adjust our posture to make sure that we can meet the needs. So, we haven't had to make substantial modifications to our operating room scheduling, and we're trying to find resources elsewhere within the facility to make sure that we can ramp up certain things, like, for example, our monoclonal antibody infusion clinic ramped up yesterday, now with the ability of seeing 6 to 8 patients per day. But we're relocating and reassigning folks, but not from some of those areas. So we have not yet had to curtail any kind of elective procedures at this time. We are, though, seeing considerable increases in some of our urgent and emergent outpatient services, and with some record numbers in both the urgent care and also very high numbers that have been sustained within the emergency department. And notably, those have been accompanied by increases in the proportion of those patients seeking care that have influenza-like illness, which is like a marker for COVID-like illness. 16% of those patients in the emergency department have had influenza-like illness, and really remarkably so, 47% of those patients seeking care at the urgent care center have demonstrated influenza-like illness as well. And we look at our 7-day and our 14-day averages of our percent positivities, and those are also kind of trending upwards and then remaining somewhat consistent. For the last 7 days or so, we've been about 8.3, 8.4% positive, and for our 14-day average is around 7%. The state last reported for our region at about 7.45%.
Very good. And actually, the monoclonal antibody therapeutic intervention clinic, can you go into what is that? I mean, that's, I think, exciting news is therapeutic intervention, but I'm not quite sure most of us know what that even means.
Sure. Thanks so much, Megan. The monoclonal antibody infusion is a certain medication that's been developed, which is it's basically antibodies to COVID that can be infused into high-risk individuals within 10 days of their diagnosis of COVID. And under those conditions, those folks that meet certain inclusionary criteria being high risk, either older folks or folks with significant comorbidities, it's been shown that the infusion of monoclonal antibodies will reduce the likelihood of someone requiring a hospital admission. And so it's a great medication, especially when we have scarce beds available in the facility and limited human resources also. It's a great resource to try to keep folks out of the hospital. And so there are a number of these clinics that have popped up within the Four Corners region. Some of them right up in Colorado, I think Cortez and Pagosa. And I believe that Northern Navajo Medical Center in Shiprock is going to be opening up a clinic sometime in the near future. And we've had our clinic open for months, and we've actually shared much of the tools that we've developed to operate the clinic with a lot of these surrounding facilities in the hope that we can get this needed therapy, which could really prevent people from needing to be hospitalized, out to folks in the Four Corners. So we're trying to increase our capacities locally as well to make sure that we create as much access as is possible for folks out there.
Good to know. And Dr. Greenberg, let me ask you a little bit too about these variants that we're hearing about, of course. And now I believe the Delta variant is pretty well established here in New Mexico. And I think when you test, do you get the test results back about what type of COVID the person maybe is testing positive for? Is it which variant or things along that line? Can you give us some ideas, especially what you see here in San Juan County, of how prevalent the Delta variant is? And then I guess we're hearing now about a Mu variant. I'm learning my Greek alphabet again as we go.
Again.
But can you give us some updates on Delta and then anything else that's coming down the pike that people are concerned about?
Absolutely. Well, the Delta variant really has become the dominant variant within the United States of America. And as you may remember, when we first started having these conversations, the original variant that really came out of Wuhan, China, that's what we call the wild type variant. So the original one. And then after that, we had a whole series of other variants, notably the variant that came from the UK, which was known as Alpha. That one really took the place of the wild type variant. And then there was a whole series of different ones that sort of shared the same, shared the infections kind of broadly among a series of variants. And then Delta came along, and Delta essentially has crowded out all of the other variants. And so when we do testing for COVID locally, we test for the presence of COVID either being via antigen testing, immunofluorescence testing, or PCR testing. And that tells us if it's COVID positive or COVID negative. Now, when it comes down to variant testing, the state laboratory division does that testing, and they actually do sampling of all of the regions within the state of New Mexico, and then they perform genomic testing or genetic analysis to the different viruses, and then they can actually determine which variants are present. So we don't do that locally, but it is done on a routine basis. Now, that surveillance within the state of New Mexico has demonstrated what has been also the case across the country, which is that Delta has crowded out every other variant. And so Delta really now represents well over 95% of all of the different variants that have been categorized within the state of New Mexico. And the same is the case across the country. And so really right now, if you have COVID, you have Delta. So that is very concerning because Delta itself appears to be considerably more infectious. We also always keep track of the variants to make sure that because we're concerned about changes in transmissibility, changes in mortality and morbidity, and of course, whether or not the variants have the capability to escape any developed immunity.
That's a terrifying thought.
Right.
I just had to take a moment to take that in. And it seems, and I don't know if the science bears this out, but that Delta is hitting children in a way that the other variants did not, or maybe it's just because children are back in school in person, so they're more exposed. I don't know. But is this true? Is Delta more dangerous for children?
Well, I think that what we're seeing, let's if we could, if anyone is willing to go back into a time capsule to 2020, now might be the time. Because when we were going through this in 2020, we actually had so many different unknowns that in addition to vaccination, we had very broad-based public health measures, which helped segment some of the population and protect it from exposure. Most notably, and very importantly, not without consequence, schools were largely completely turned upside down last year. The children's exposure to COVID in general was limited considerably, and everyone was masking, social distancing. There were considerable public health orders that limited travel and certain kinds of commerce. So there was really a full court press across all of society to try to reduce transmission because we didn't know as much as we know now. Now we've enjoyed a period of time where the virus itself has waned. We've rolled back a lot of those public health measures, and it really doesn't look like we're going to be going back to those public health measures, at least at this time. And so we don't have the same kinds of layers of defenses that we did to protect against certain kinds of populations. What we do have is vaccination, which is a great layer of protection. But you're right, Megan, going back to school definitely increases the risk of transmission. We're already very familiar with how influenza spreads throughout student populations in every age group. And COVID is very similar. And Delta is indeed more transmissible, has higher viral loads. And it's really important for these kids to mask and to socially distance and to wash their hands frequently. In areas around the country where schools have gone back into session without masking, there really has been a marked increase in infections in those age groups. And that has been significantly mitigated in other schools around the country where masking has been required. And so within the state of New Mexico, masking is required in the schools, and thus we're all hoping that we're seeing little to no transmission among children. But it indeed is a concern that we would see increases in the proportion of children that are infected. In other regions of the country, Louisiana and Texas, for example, new infections, I believe, were between 25 and 28% of the new infections were children. And so we're not seeing that kind of proportion at this time. There is considerable testing that's occurring within the state of New Mexico. And everyone is keeping very close eye on what happens epidemiologically with the spread among children.
Great. And one last question before we wrap up. Ivermectin, I just want to be like, Ivermectin, go. Just provide some sort of voice of reason.
Please.
Sure. So Ivermectin is a FDA-approved medication that is used to treat parasites, internal and external parasites. And when usually prescribed for approved indications, it's usually fine. People tolerate it pretty well. There's human formulations and there's also veterinary formulations that are available, but most notably those are not intended for human use. It is not authorized or approved by the FDA for prevention or treatment of COVID-19. And they have ongoing clinical trials that have not demonstrated any benefit associated with it. There are significant adverse effects associated with ivermectin misuse. The National Poison Centers have shown that there's a marked increase in the number of overdoses and misuse associated with ivermectin. And those folks do experience considerable adverse effects. And and those poison centers really are seeing like a 5-fold increase in the number of ivermectin-related calls, and often associated with ingestion of veterinary ivermectin compounds. And those can be associated with very low blood pressures, as well as neurologic effects, things like decreased level of consciousness, confusion, hallucinations, seizures, coma, and even death. So, I mean, it also can potentiate, the effect of other drugs that cause central nervous system depression. Those are other medications you might use, like barbiturates or benzodiazepines, like Ativan or Valium or something like that. So we're seeing these case reports of these like incredibly large ingestions of ivermectin. But the thing that I really hope people understand is that ivermectin really doesn't treat anything related to COVID-19. So it is not an adequate substitute for it. I know there's a bunch of stuff that in the politicized media that talk about ivermectin, how it may be wonderful. It is just not true. The science does not support the use of ivermectin for COVID-19. If and when the science does support any medication or any approach to the treatment of COVID-19, we will, of course, adjust course. But at this time, there's all these significant side effects that are associated with this, and this really is like a folk remedy. It's like we're in the 21st century, and we're in the midst of folks taking a medication essentially designed for deworming, predominantly for veterinary sources or veterinary causes, and they're taking it to treat COVID-19. It's a little bit of a head scratcher for us, but we remain sort of ready, at least in the emergency department, looking for folks to present with adverse effects of ivermectin ingestion because they're try to take care of COVID-19. Really, if you are concerned about COVID-19, the key thing is not to take a unproven medication that can harm you. The key thing would be to get vaccinated. That's a well-studied, probably the best studied medication in the history of modern medicine at this time, with hundreds of millions of people receiving this medication with incredible surveillance and a great safety profile. If you're worried about COVID-19, get vaccinated. Don't take a medication that's designed for deworming, mostly farm animals, or the occasional use for humans for parasitic infections. So, like I said, it's a little bit of a head scratcher for us. I think that the current evidence about ivermectin is really clear when it comes to the science. So we just need to stay away from the politics, stick to the science, do the things that actually work, and avoid those things that can harm you that don't.
Very good. Thank you so much, Dr. Brad Greenberg, for joining us today. We really, as always, appreciate your time. As you stated, the ER is very busy, so we appreciate you hopping on this call.
Yes, thank you.
You bet. Thank you both, and my pleasure, and stay safe out there.
You too, Doctor. Thank you very much. That's Dr. Brad Greenberg, of course, from Center Regional Medical Center.